Question 1. What is the primary reason for inserting an arterial line in a patient with shock? A. Continuous blood pressure monitoring. B. Administration of vasopressors. C. Blood sampling for glucose testing. D. Monitoring central venous pressure. Answer. A. Continuous blood pressure monitoring. Question 2. A patient in early septic shock develops hyperglycemia. What is the best nursing response? A. Monitor blood glucose closely. B. Stop for fluids immediately. C. Increase caloric intake. D. Administer additional insulin without orders. Answer. A. Monitor blood glucose closely. Question 3. In neurogenic shock, the loss of sympathetic tone primarily results in which clinical finding? A. Hypotension and bradycardia. B. Tachycardia and hypertension. C. Cyanosis and fever. D. Hyperventilation. Answer. A. Hypotension and bradycardia. Question 4. What is the nurse's priority when administering antibiotics to a patient in septic shock? A. Administer antibiotics within 1 hour of order. B. Monitor urine output. C. Maintain patient in reverse Trendelenburg. D. Limit for fluids. Answer. A. Administer antibiotics within 1 hour of order. Question 5. A patient is receiving 4-norepinephrine. What assessment requires immediate intervention? A. Skin around foresight is pale and cool. B. Heart rate is 80 per minute. C. Blood pressure is 120/80. D. Urine output is 35 ml per hour. Answer. A skin around foresight is pale and cool. Question 6. In cardiogenic shock, decreased cardiac output results in which priority nursing concern? A. Impaired tissue perfusion. B. Risk for electrolyte imbalance. C. Risk for altered nutrition. D. Disturbed sensory perception. Answer. A. Impaired tissue perfusion. Question 7. A patient in hypovolemic shock is receiving fluid resuscitation. What indicates effective therapy? A. Urine output increases to 40 ml per hour. B. Central venous pressure decreases. C. Respiratory rate increases. D. Skin remains cold and clammy. Answer. A. Urine output increases to 40 ml per hour. Question 8. The nurse is caring for a patient with shock and severe hypotension. Which medication is typically used first? A. Vasopressors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. Answer. A. Vasopressors. Question 9. What is the priority nursing assessment for a patient receiving a massive blood transfusion to treat hypovolemic shock? A. Monitor for transfusion reaction. B. Measure abdominal girth. C. Monitor pupil response. D. Encourage early ambulation. Answer. A. Monitor for transfusion reaction. Question 10. Which laboratory result supports the presence of septic shock? A. Elevated serum lactate. B. Low potassium level. C. High serum sodium. D. Normal white blood cell count. Answer. A. Elevated serum lactate. Question 11. What is the nurse's priority action for a patient who develops stridor after a bee sting? A. Administer epinephrine immediately. B. Monitor blood glucose. C. Place patient in high Fowler's position. D. Start for normal saline. Answer. A. Administer epinephrine immediately. Question 12. Which is the earliest sign that tissue perfusion may be compromised in a shock patient? A. Restlessness. B. Cyanosis. C. Hypotension. D. Decreased urine output. Answer. A. Restlessness. Question 13. Which assessment finding suggests a patient with shock is progressing to the irreversible stage? A. Anuria. B. Anxiety. C. Tachypnea. D. Tachycardia. Answer: A. Anuria. Question 14. The nurse notes cool extremities in a patient being treated for shock. What is the most likely cause? A. Peripheral vasoconstriction. B. Hypermetabolism. C. Diabetic neuropathy. D. Hyperglycemia. Answer: A. Peripheral vasoconstriction. Question 15. A patient in shock shows signs of acute respiratory distress. What is the nurse's priority action? A. Administer oxygen. B. Insert a Foley catheter. C. Elevate the legs. D. Start beta blockers. Answer: A. Administer oxygen. Question 16. Which finding is expected during the compensatory stage of shock? A. Increased heart rate. B. Decreased respiratory rate. C. Increased urine output. D. Hypoglycemia. Answer: A. Increased heart rate. Question 17. In a patient with anaphylactic shock, what is the main purpose of administering epinephrine? A. Reverse airway constriction. B. Lower blood pressure. C. Slow heart rate. D. Increase urine output. Answer: A. Reverse airway constriction. Question 18. What finding would suggest effective treatment of hypovolemic shock? A. Blood pressure stabilizes. B. Heart rate increases. C. Respiratory rate increases. D. Pupils dilate. Answer: A. Blood pressure stabilizes. Question 19. In a trauma patient, what is the earliest indicator of hypovolemic shock? A. Tachycardia. B. Bradycardia. C. Hypotension. D. Cyanosis. Answer: A. Tachycardia. Question 20. Which nursing intervention takes priority when caring for a patient in the early stage of septic shock? A. Obtain blood cultures and start antibiotics. B. Apply compression stockings. C. Provide high-protein diet. D. Administer blood transfusion. Answer: A. Obtain blood cultures and start antibiotics. Question 21. Which is the earliest clinical sign of hypovolemic shock? A. Increased heart rate. B. Decreased oxygen saturation. C. Decreased blood pressure. D. Increased temperature. Answer: A. Increased heart rate. Question 22. What should the nurse monitor first when initiating vasopressor therapy in shock? A. Blood pressure. B. Blood glucose. C. Abdominal girth. D. Temperature. Answer: A. Blood pressure. Question 23. A patient with neurogenic shock is at greatest risk for which complication? A. Deep vein thrombosis. B. Hyperglycemia. C. Fluid overload. D. Hyperthermia. Answer: A. Deep vein thrombosis. Question 24. What assessment finding indicates fluid resuscitation is effective in a patient with septic shock? A. Urine output of 50 ml per hour. B. Capillary refill greater than 3 seconds. C. Decreased breath sounds. D. Cold and clammy skin. Answer: A. Urine output of 50 ml per hour. Question 25. In obstructive shock caused by tension pneumothorax, which action is the priority? A. Needle decompression. B. Administering antibiotics. C. Performing chest physiotherapy. D. Positioning patient in high Fowlers. Answer: A. Needle decompression. Question 26. Which statement by a patient indicates understanding of the purpose of epinephrine in anaphylactic shock? A. It will help open my airways. B. It will decrease my blood sugar. C. It will make me sleepy. D. It will slow my heart rate. Answer: A. It will help open my airways. Question 27. A nurse notes cold extremities and delayed capillary refill in a shock patient. What is the cause? A. Peripheral vasoconstriction. B. Peripheral vasodilation. C. Increased blood glucose. D. Hyperkalemia. Answer. A. Peripheral vasoconstriction. Question 28. Which type of shock is associated with high cardiac output and low systemic vascular resistance? A. Septic shock. B. Cardiogenic shock. C. Hypovolemic shock. D. Obstructive shock. Answer. A. Septic shock. Question 29. A nurse should expect to administer which type of fluid initially for hypovolemic shock? A. Isotonic crystalloid. B. Hypertonic saline. C. Hypotonic saline. D. Dextrose 5% in water. Answer. A. Isotonic crystalloid. Question 30. Which vital sign trend indicates improvement in a patient with septic shock? A. Increased urine output. B. Decreased respiratory rate. C. Lowered heart rate below 60. D. Decreased level of consciousness. Answer. A. Increased urine output. Question 31. Which finding indicates worsening cardiogenic shock? A. Increased crackles in lungs. B. Warm and dry skin. C. Increased urine output. D. Strong peripheral pulses. Answer. A. Increased crackles in lungs. Question 32. In which type of shock does loss of sympathetic tone occur? A. Neurogenic shock. B. Hypovolemic shock. C. Septic shock. D. Cardiogenic shock. Answer. A. Neurogenic shock. Question 33. What does an increasing serum lactate level suggest in a shock patient? A. Inadequate tissue perfusion. B. Decreased hemoglobin level. C. Improved cardiac output. D. Hypercalcemia. Answer. A. Inadequate tissue perfusion. Question 34. The nurse assesses mottled skin and absent pedal pulses in a shock patient. What should be done first? A. Notify the provider immediately. B. Increase fluid rate. C. Elevate the patient's legs. D. Apply warming blanket. Answer. A. Notify the provider immediately. Question 35. Which intervention has priority for a patient in anaphylactic shock? A. Administer epinephrine. B. Administer diphenhydramine. C. Obtain serum tryptase level. D. Apply cold compresses. Answer. A. Administer epinephrine. Question 36. The nurse monitors for what complication during large volume resuscitation in shock? A. Pulmonary edema. B. Hypoglycemia. C. Increased heart rate. D. Constipation. Answer. A. Pulmonary edema. Question 37. In the progressive stage of shock, the nurse expects which finding? A. Lactic acidosis. B. Hypernatremia. C. Increased urine output. D. Hyperglycemia. Answer. A. Lactic acidosis. Question 38. Which position optimizes oxygenation in a patient with cardiogenic shock? A. High Fowler's position. B. Trendelenburg position. C. Supine position. D. Reverse Trendelenburg. Answer. A. High Fowler's position. Question 39. A patient receiving norepinephrine shows pale, cold fingers. What should the nurse do first? A. Stop the infusion. B. Reposition the extremity. C. Apply a warm compress. D. Document the finding. Answer. A. Stop the infusion. Question 40. Which is a priority goal of treatment in obstructive shock? A. Relieve the mechanical obstruction. B. Increase heart rate. C. Reduce oxygen demand. D. Increase blood glucose level. Answer: A. Relieve the mechanical obstruction. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.